A government review suggests that small-time criminals driven by their drug habit need help rather than prison time.
Yeah, Dame Carol Black warns in her review that many drug users are cycling in and out of prison without being rehabilitated for their abuse, and they're not essentially being treated effectively.
Well, her review also found that the drugs market is driving most of the nation's crimes, with half of all homicides and half of acquisitive crimes linked to drugs.
Well, Dame Carol should be joining us now. Welcome to GB News. If we spare these small-time criminals prison, what punishment instead should they serve?
I think if you look at the review, it's trying to say, how do you help people who've got a drug habit rehabilitate? And there are many ways of doing that. And if you look at what the police have been doing in Durham or Avon with their diversion schemes, or if you look at what NHS England has been setting up, in which they're combining treatment with mental health support instead of sending everyone down the prison route. I visited many prisons when I was doing part one of this review, and it was quite obvious that sending someone to prison for 3 months, for 4 months, for perhaps a very minor crime was actually making it worse. And there were more drugs for them to try in prison. And there were gangs in prison who might engage with their families and make it worse for their families. We've seen drug diversion into community sentencing really go down in numbers in the last 8 years. I think it's time to think of drug addiction as a public health issue. And for some people, of course not all, consider whether community diversion with rehabilitation would be a better route. It's certainly, I think, a way worth trying. And of course, it costs less money as well as all the human benefits.
You've described the services involved in this as on their knees. Is all of this really about a lack of money?
It's partly about a lack of money. I think there are two really important drivers, and they go back several years. So one of the drivers is the increased amount of heroin and cocaine that has flooded the market. There have been very good seasons in the countries from which they come, and there's been a very, very good supply into our country, and therefore the drugs are purer when they're sold, so they don't have to pack them with so many other things. We've seen a growth in criminal gangs. They've flooded our urban centres, and so they've gone out to our countryside and to seaside towns. So there's that side, there's a supply side. And of course, you can buy drugs in many ways now. And then there's the austerity of the last, should we say, 8 years. So local authorities have had their budgets cut, and therefore there's been a lack of what I might call the protective factors that would have protected young people and families, whether it be youth clubs, support for families in trouble. It's that almost perfect storm of an increased supply, great availability and purity, and then lack of funding. And we quite simply can't reverse this without we do something about the funding. I've made that quite clear in the review.
Is there not also a question about the legality of drugs full stop? Because a lot of people, especially when they get addicted to hardened drugs, what is a driver of their crime is accessing the funds to pay people who are essentially criminal to buy things on the black market. They then start associating with, all sorts of characters who might lead them in the wrong direction. And certainly with some of the drug treatments, for instance, methadone for heroin, there's always been a big argument that actually heroin is best treated with heroin, but coming down in reduction. So do you think that there's a bigger debate to be had here about actually legalising certain drugs?
In my review, in my terms of reference, I wasn't allowed to look at anything that required a change in the law. And I think when you just look at my review, the two reviews together, there's more than enough for us to get on with now that would make an immediate difference. to people's lives. The people who take heroin and crack come from our most deprived communities. It's not equally distributed throughout England. And they are often people who have grown up in really rather awful conditions, not always, of course, but there's so much that can be done now to help people who have a drug dependency problem. We don't need a change in the law to do any of that.
Dame Carol, the Health Secretary, Sajid Javid, he says ministers, I think, would look closely at your recommendations. The government has announced it's going to follow up one of the recommendations to set up a new cross-government unit on tackling drugs misuse. But haven't we heard this all before?
Well, actually, Sam, I don't think you have heard all that's in the report before. I think you've heard many attempts, but I think...
What about the reaction to it? Sorry, it's more the government response. We've had many very laudable reports, and yours really does hit home for many people. But the government has to do something based on those reports.
Well, I think it will. I have to say, much of the work, I've done a lot of work, of course, for government. I have never seen such cross-government interest as with this particular report. I've had 6 departments of state working with me, not against me, in the last year, really seeing where's their particular slot in adding to the solutions. I've seen a great interest from the Prime Minister himself and from Number 10. I am hopeful that bringing this together in a central government unit with a minister who will report to Parliament annually with a national outcomes framework, I think we're in a very good place to really make a difference.
So I agree with a lot of what you're saying. I'm a big believer in rehabilitation as a concept. But there will be people out there who think, well, hang on, mental health is a massive issue in today's society. It's affecting everybody, especially the results of, lots of people being locked up for a year and a half. There'll be people coming off furlough, losing their jobs.
Locked down rather than locked up.
Sorry, locked down.
Yeah.
There you are. But there'll be people coming off furlough who are losing their jobs. Suicide rates are likely to spike, especially among young men who perhaps haven't ever done anything, haven't put a foot wrong in their life, when we've already got massive burdens on the social care system and we need massive investment into mental health care provision. There are bound to be people out there who think, well, a lot of these people might not be able to be saved. And, if they're not prepared to put in the effort and the commitment themselves, and clearly we've already got a lot of programmes on offer via the NHS, via support services, via charities, then why should we, the taxpayer, be doing even more and paying even more when, frankly, everybody needs a bit of help right now?
Well, I think if you look at the social problem that drug dependency creates, you could make a very good case. 50% of homicides are drug-related. 45% of serious crime is driven by drugs. A third of our prison places are taken up by people who have a drug-related problem. It is a huge social problem. So many of the people who are drug dependent have, as the genesis of that problem, or it has developed with their drug taking, mental health and trauma. If you want to get on top of a really big social issue, and of course it's a choice, and of course there are many urgent problems, I've just tried to make the case to government of why, if you want to reduce murder, you want to reduce serious crime, you want more free places in our prisons, you have to deal with drug dependency. There is no other way round the problem.
There is a real issue with the whole concept of stigma around drug abuse at this level, isn't there?
There is, and I think, as you'll see in the report, I made the case for treating drug addiction as we treat any other medical chronic condition. It's never been treated that way. It's been stigmatized. The services that are available to people who are addicted in either mental health or in their comorbidities, they get lung disease, they get HIV, they get infections. It is not a parity. If I, as a woman, got breast cancer, nobody would think that I didn't deserve to have really ongoing good treatment. Well, if I were drug dependent, I wouldn't have that same parity. I wouldn't be considered in the same way. If we want to reduce the stigma that is associated with drug addiction, then I absolutely think we've got to give it parity with other chronic conditions. We've got to accept that you'll have ups and downs. There'll be relapses. I'm a medic. I'm a rheumatologist. I've looked after people with chronic conditions for 30 years. I don't disband them and send them out into the wilderness when they have a relapse. I get on top of it as quickly as possible and try to get back to an even keel. This is what we've got to do in drug addiction. There are no easy routes, but I think treating people as if they have a health condition would be a great help.
But when you talk about treating people as if they've got a health condition, as I said earlier, lots of organisations do this, and there's sort of domiciliary care, there's institutions you can go and actually check into, and these cost a lot of money. And then very often people who have got problems with drug addiction, they just keep going back. It's so easy to tempt people. It takes one misstep and they're back where they began, and all of that money and that investment has gone nowhere. In terms of, actually trying to prevent people going into prison who are drug addicts and giving them the treatment and the support they need, what's that going to involve that isn't on offer already? And how many of them are actually going to succeed?
Well, if you only really read the report in detail, you would see that what is on offer at the moment has over the last 8 years deteriorated enormously. What is on offer treatment-wise, to give you one very practical example, is that a drug worker should have possibly 30 people on their list. At the moment, the average is 50, and for some, it's 80. We have fewer number of psychiatrists, fewer number of social workers. The number of people who've been able to access inpatient detoxification has gone down by almost 40% in the last 8 years. It is not a good picture out there. It is, in fact, a service that is creaking at the seams. And almost anybody you talk to who really knows the service will tell you that this is what is there.
Then, Carol, we can see your frustration. You've been talking to us, 11 minutes? You've been doing a round of interviews, some of which no more than 2.5, 3 minutes. And I'm just wondering if you have a sense that we, the public, we, the media, we need to spend a bit more time just talking about this, just trying to understand what the problem is, rather than quick fixes, which is what we all seem to expect these days.
There are no quick fixes, Simon, to this. This is a huge societal problem. And if you look in the review, I suggest to start with a 5-year programme. I think it probably will take more than that. But I think we've got to look at the complexity to help somebody get over drug addiction. You need clinical services, you need mental health, you need a period of recovery that could be several years. You need people who've been drug dependent to be part of that journey, the people who can be the peer support. You need safe housing. You need to give somebody something meaningful to do, because if you do enable them to get clean, there's a big black hole, and they need something that fills that. I don't believe this is a short journey. I don't believe that we can do it quickly. I believe we've shoved it under the carpet. I believe, rather like Mother Teresa many years ago said, that people who are addicted to drugs will be the lepers of the next century. And she was talking about this century. I think people who are addicted to drugs are rather like modern day lepers.
During your research, was there one story, one person who to you highlighted in a very personal way what the problem here is?
Well, there were many, but I think what is so frustrating, the stories you hear of how it may have taken 20 years from a young person who perhaps gets addicted in their early teens, that has to hit absolute rock bottom. in so many ways, living on the street, really at risk of losing their lives. More than one admission, going into prison, often several. It's rather like a hamster wheel. And if they're lucky, and if they are lucky enough to get a place at a rehabilitation centre, which is exceedingly difficult today, they may come through. But that was not just one story. I've talked to people in prison, out of prison. You know, you only have to listen to these stories to just know how difficult this subject is. But what a damage it does to society. We could do better.
Jane Black, thank you so much for joining us, and thank you for your hard work and your compassion. And it's been wonderful talking to you today.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.